This video is about the wide branch shoe and its impact on the distribution of pressure, the orientation of the digital bones and the process of placing the hoof. The data presented here were raised by a scientific cooperation between Werkman Horseshoe Factory and the Institute of Veterinary Anatomy Leipzig. The wide branch shoe is a common modification regarding the mediolateral level. By adding the corresponding part of the ortho kit to a standard horseshoe, the outer branch was widened by 1/3 of its original size. This surface modification took place within the hoof silhouette. The inner branch was narrowed with the help of a creaser, so that the surface interacting with the ground was smaller compared to the weight-bearing surface interacting with the hoof capsule. The manufacturing of the wide branch shoe is demonstrated by Mitch Taylor in the corresponding video. The wide branch shoe is a therapeutic horseshoe which enables unilateral support of the medial or lateral half of the hoof, aiming to influence the mediolateral orientation of the distal toe bones. The wide branch shoe alters the positioning of the hoof and the coffin bone, intending to influence the joint space symmetry. Therefore, main indications are cases of unilateral diseases or arthrosis of the joints, in which the broadened branch is applied to the healthy half of the hoof, and collateral ligament lesions which require the broad branch to be beneath the affected half. Additionally, unilateral disorders of the extensor branches of the suspensory ligament are treated with wide branch shoes. In general, this horseshoe modification is used to optimize the joint space symmetry and to compensate lateromedially abnormal positions of the limb. The effects of the standard as well as the wide branch shoe were examined by radiological and pressure measurements. The radiological examinations followed a standardized protocol and were carried out on a firm and soft X-ray block in order to simulate different types of ground. 2 pressure measurement sensors were simultaneously fixed on the hoof, and every examination was carried out on 4 different types of ground. You will find detailed information on methods and the execution of kinetodynamic examinations in earlier lectures on this homepage. Now we explain the wide branch shoe's influence on the mediolateral orientation of the coffin bone in relation to the ground. The barefoot situation as well as the usage of standard horseshoes in 5 horses serve as a comparison. Every radiographic examination was carried out on a firm wooden block and a block with soft padding. On hard ground, we see that the application of a wide branch shoe has no influence on the mediolateral orientation of the coffin bone. On soft ground, it becomes obvious that the broadened branch prevents the supported half of the hoof from sinking in, whereas the narrow inner branch facilitates the penetration of the ground. Therefore, the hoof and the coffin bone will sink in on the medial side. The following 3 examples will demonstrate the relation between the orientation of the coffin bone, which is influenced by the wide branch shoe, and the joint space symmetry. In this first case, hoof and coffin bone are orientated laterally on soft ground. Hence, the joint space opens to the lateral side. When employing a wide branch shoe, the outer half of the hoof is prevented from sinking in, whereas the inner half penetrates the ground easily. Both hoof and coffin bone tilt medially, and the distal interphalangeal joint space narrows on the supported side. Thereby, a more even orientation of the coffin bone and an optimization of the joint space symmetry could be obtained in this example. In the second example, the barefoot hoof and its coffin bone are positioned almost evenly on soft ground. The joint space shows an opening towards the lateral side. The application of a wide branch shoe shows the same effects as mentioned before, and the coffin bone tilts towards the medial half of the hoof. Despite the severe positional change of the distal phalanx in this example, we can observe no effect on the joint space symmetry. The third example shows that the application of a wide branch shoe causes the hoof and the coffin bone to tilt medially on soft ground. In this case, however, the joint space widens on the supported side, which is prevented from sinking into the ground. So the effect on the joint space symmetry is contrary to what would be expected. It becomes obvious that, although the effect of a wide branch shoe on the alignment of the coffin bone seems constant, the influence on the distal interphalangeal joint space is more difficult to predict. The reason being additional factors apart from hoof and coffin bone orientation which affect this parameter. One factor is the composition of the ground, with special regard to consistency and homogeneity. For this study, that factor was kept constant during all measurements, which is nearly impossible to achieve in real-life situations. Furthermore, earlier studies concluded that the orientation of the middle and proximal phalanx have a greater influence on the joint space of the coffin joint. So, the effect that the conformation of the limb and the individual build of the horse has is very important too. In addition, a radiograph can only show a static snapshot of the biomechanic situation. In reality, the joint space symmetry is changing constantly in relation to position and load of the limb. Despite using a standardized measurement protocol for all X-ray images, this factor is difficult to predict and has an influence on the joint space symmetry. All factors mentioned before may interfere with the effect of a wide branch shoe, and special dynamic examinations regarding this point will follow. On hard ground, the wide branch shoe shows no effect on the dorsopalmar alignment of the coffin bone. On soft ground, the widened branch prevents the supported half of the hoof from sinking into the ground, which causes a slightly steeper orientation of the hoof in comparison to a barefoot hoof or the application of a standard horseshoe. As the wide branch shoe modifies the shoe's surface within the hoof silhouette, it enlarges the weight-bearing surface without increasing the lateral lever arm. If the widened branch should exceed the boundaries of the hoof capsule, the lateral lever arm would increase, which may cause problems during the footing process or during turns. Still, this variation of the wide branch shoe can be used for the treatment of abnormally positioned limbs. Each horseshoe has, besides the effect on bones, ligaments, tendons and joints, an influence on the distribution of the forces interacting with the hoof capsule. This section demonstrates which ground reaction forces develop directly between ground and horseshoe and the way they are transmitted towards the hoof capsule. The resulting extent of the loaded area has a significant effect on the pressure force distribution. This area on the horseshoe, as well as the weight-bearing surface of the hoof capsule, increases by about 10 cm squared after the employment of a wide branch shoe. Now we want to examine the pressure forces which develop between horseshoe and ground on hard ground while walking. A standard horseshoe was used as a comparison. The pressure distribution pattern of a wide branch shoe shows that the widened branch picks up considerably more load. These forces are transmitted directly to the hoof capsule so that the lateral half of the hoof is loaded heavier by up to 5 to 10% compared to a standard horseshoe. Distinct pressure peaks are observable at the lateral weight-bearing margin beneath the widened branch. The wide branch shoe develops an evident effect on soft ground which allows different parts of the hoof to sink in. Looking at the pressure distribution patterns of a wide branch shoe in deep sound while walking, the following becomes apparent. The widened outer branch is prevented from sinking into the ground, leading to an enhancement of the ground reaction forces. As a result, the outer branch is clearly visible. The load is directly transmitted to the hoof capsule, where pressure peaks in the area of the supported lateral weight-bearing margin become apparent. As the narrowed inner branch enters the ground easily and the hoof begins to tilt medially, the solar surface of the inner half of the hoof becomes increasingly involved in the weight-bearing process. It is noteworthy, however, that increasing the pressure unilaterally on an unstable hoof capsule may lead to contusion of the coronary band. The affected side may show a compression of the hoof cartilage which, when loaded, is pushed outward as part of the hoof mechanism. This, in turn, can lead to tension in the corresponding areas of the hoof capsule, which may result in horn cracks of the lateral wall. The footing pattern is formed out of several steady steps which are averaged into one picture so that it shows the migration of the centre of force during the main stance phase. The average picture shows the footing, the movement during the main stance phase, the unrollment and the point of breakover. As you can see in these three examples here, the comparison of the footing pattern between standard and wide branch shoe shows that the mediolateral modification of the horseshoe surface has almost no influence on the individual footing pattern. Only in the last two examples, the tendency to place the hoof beginning with the widened branch seems to be strengthened. This may be a result of the additional weight originating from the widened outer branch. In general, these deviations are considered to be negligible side effects and are neutralized on soft ground. Summing up, the application of a wide branch shoe results in the following effects. The influence on the orientation of the distal toe bones is only observable on soft ground. Therefore, if the wide branch shoe is considered for therapeutic use, the ground on which the horse is kept primarily during the healing process should be agreed upon with the owner. Furthermore, the effect on the orientation of the distal toe bones is only constant in the mediolateral plane. The influence on the joint space symmetry seems to be affected by further factors, which at times mask the effects of the wide branch shoe. The additional load on the lateral solar margin, which relates to the widened branch, is not to be neglected. It is beneficial that even though the loaded area increases, the toe to support ratio isn't affected in any way. Also, the effects on the individual footing pattern can be ignored. Due to the unwanted side effects on the pressure-force distribution pattern and the discontinuous influence on the joint space symmetry, this orthopedic horseshoe modification should be considered as a supplementary and temporarily limited therapeutic treatment. When using a shoe modification like this, usually the effects on tendons, ligaments, bones and cartilage are at the centre of attention. Often the impact on the surrounding hoof capsule takes a back seat. By changing the pressure distribution and the supporting surface, we influence the sensitive blood circulation and the horn architecture significantly. Furthermore, additional tension within the horn of the hoof capsule can provoke horn cracks. On the whole, all the anatomic structures forming the distal extremity form a close regional and functional relationship. Therefore, the unilateral narrowing of the joint space will inevitably cause an additional load for this joint surface and distinct stretching of the collateral ligaments on the other side. It is safe to assume that relief for one structure causes additional strain on the counterpart, so that the efficacy and the temporary limitation of a shoe modification should be carefully considered for each individual case. Many thanks to all our assistants, and thank you very much for your attention.